What is your take on MBBS versus BDS?
See, honestly, doctor, what I have seen is the legacy follows.
But what if you're a first generation medico?
If you are looking for a correct return on investment, then there is no better options than dentistry.
What would be your priority?
First, you should look at the course, then the college.
Any advice for people who want to take up BDS or who are confused whether they should or should not?
See, dentistry is not science and art. Dentistry is rather art and science.
Okay. Hi everyone. Hello sir. How are you?
Hello. I'm good. Thank you, Dr. Palak.
So I'm having a very deja vu sort of a moment today because 5 years ago, when I was a student back after NEET, I had no clue what I was doing in life. And today, after the entire circle, after meeting you today, I feel that finally there is somebody who is having a clear picture and is able to guide people truthfully. So I'm really, really happy to meet you and have this discussion today.
Thank you, Palak.
So after so many years of being in the industry for career counseling, what is your take on MBBS versus BDS? It's an entire dilemma for not just students but for parents, in fact grandparents. So what's your take on that?
See, honestly, doctor, what I have seen is the legacy follows. 90% of the students who are doing dentist means they will do dentistry even if they are getting a seat in MBBS would be because their parents are also dentist. And 90% of the children whose parents are into medical profession, they will choose MBBS because their parents are from the same fraternity or from the same background. There has been very less instances when I have seen children of medical fraternity doing dentistry and children of dental fraternity doing medical. So this is what my experience says.
Right. But what if you're a first generation medico? Like you don't know anything from your parents or from your inner circle. So what is the pathway to understand that, okay, this is what I should be doing? How should I eliminate either MBBS or BDS?
See, firstly, it will depend upon your paying capacity because the fees of MBBS is relatively very high. If you are looking for a correct return on investment, then there is no better options than dentistry.
Okay.
Of course, people look high, means those people who have done MBBS, they are looked upon as a with very high regard. And the same goes for dentistry as well. If you are doing well, the same socioeconomic status you can earn in the society. So I don't see that there is much of a difference apart from the glamour.
It's glamour and it's peer pressure also because everybody around you is just talking about MBBS.
Yes.
But there are 1,000 other courses that nobody is really talking about.
Correct.
So if somebody is in their 11th and 12th or they are just sitting for counseling right now, what are the options and what are the resources that they should look up for apart from MBBS and BDS, which will give good return of investment?
See, what I would like to suggest the students is to follow their passion. I have seen children of orthopedician doing his post-graduation in psychiatry. I have seen children of a very big chain of optical shop not pursuing ophthalmology as his post-graduation, but taking up some other specialized branches. Most of the students, when they enter into their professional courses in the first year only, they can identify which sector they want to get themselves specialized into. This is for medical and dentistry. If you look at the other courses, then the colleges matter most than the
Course.
students' interest, because lots of colleges can provide you altogether a different platform, because a basic first step is required, right? All the colleges cannot provide that platform, but yes, why the big institutes such as IIM or even some private colleges like Manipal, they all are so famous, and it's the dream of all the students to get into such kind of institutes. The reason behind is the platform.
Right. So for a student, it's a lot of confusion because first they have to decide the course, then they have to decide the college, then they have to see whether it fits into their marks, and then it's all a luck game because did my previous person take that seat or not? So what would be your priority? Like after so many years of talking to people, I'm sure you would prioritize, right? That okay, first you should look at the degree, maybe then you should look at the college, or how does it go?
First, you should look at the course,
Okay.
then the college.
Okay.
Because if we see, just for an example, if you want to do BTech in computer science, and it is the most booming branch, if you are getting BTech in computer science in IIT Bombay, means if you are not getting a BTech in computer science in IIT Bombay, you are getting BTech in mechanical in IIT Bombay. And if you are getting a BTech in computer science in BITS Pilani, of course the difference is like Aquafina and Bisleri. But the course which you are getting in BITS Pilani is of your interest. There the name will not make much of a difference. There the course will make much of a difference. Because this is something which you want to, this is the booming branch, yes. Here you will not find much of a difference, I think. It will be the most confusion area of confusion in the mind of a student. Because in one hand, you have IIT Bombay, in the other hand, you have BITS Pilani.
Right. So you should first choose the branch, see
Yes.
whether you like it or not, and then followed by that, look at the college
Yes.
and see what fits for you.
Definitely.
So, so if there is an option of MBBS versus BDS, I come back to it again and again because it was a big dilemma back then, especially because the surroundings are like that. Nobody knows that you can do BDS and still be successful simply because coaching institutes drill it into your head that सिर्फ MBBS ही होना चाहिए, नहीं तो drop ले लो. So, how, say for example, I don't know about BDS and I want to understand what should be my strengths that will fit into this course, because as a student I want to know if I will do well or not in this course, because I cannot have my passion set in 11th and 12th standard. I'm just 17 and 18 years old. So any advice for people who want to take up BDS or who are confused whether they should or should not?
See, dentistry is not science and art. Dentistry is rather art and science.
Okay.
So many students, firstly they see, it is not about if you want to take or not. The fees of MBBS in any colleges in India, in any private college, suppose if you are not getting a medical government institute, if you are getting, according to your NEET mark, if you are getting a private institute, the fees for private institutes are relatively very high. It is not cheap. The minimum to minimum will be approximately 50 to 60 lakh plus hostel plus miscellaneous other expenses are there. So first you have to look whether you are capable enough to pay that fees.
Right.
Secondly, here is not the end. You have to look forward, you have to have a long-term vision of doing the post-graduation as well. Then you have to think, okay, if I am going to do post-graduation, will I be having that much of fund again to do my post-graduation as well? The same is not in the case of dentistry. You can do BDS because there are lots of dental colleges in India. You can do dentistry at a relatively very low fees, and you can pursue your post-graduation as well because the competition is relatively lesser as compared to the postgraduate seats as compared to the competition of the postgraduate seats in the medical field. So there are lots of things which you should think, see and analyze instead of thinking कि नहीं मेरे को तो करना ही है. Because I have seen many students who have done their MBBS and they are still waiting for their post graduation seat, and they are waiting since 7 years, 8 years, 9 years, 10 years. So yeah, it is better to think and then take a step forward, because after 12th, whichever professional course you take, that will be carried throughout your life. You cannot make a stop to it. And dentistry itself is a specialized course. This everybody knows. Even if you don't do post-graduation, I think you can easily survive. Yeah. Moreover, you yourself are a dentist doctor. You know which is the most common disease, the dental caries. So कोई भी अगर है तो उसको दांत में problem होना ही है. So how much ever a person says that the dentistry is saturated, actually dentistry cannot get saturated. It is a myth.
So now, as a 17 and an 18-year-old, I have to think about finances. I have to think about my long-term goal. At the same time, I should be able to look at the pros and cons of whether I will be able to compete in that, environment.
Correct.
Right. So these are all the points that we were never told. Like your parents will never come and tell you, listen, you are not going to get a postgraduate seat on the child's face. But eventually, it boils down to a lot of decisions that we have to make at that age.
See, I will tell you one thing. People will not say it openly, but everybody knows it's his worth. I know what I am capable of. You know what you are capable of. Not 100%, but up to some mark, some percentage I know कि मैं ये कर सकता हूँ या मैं ये नहीं कर सकता हूँ. तो वो तो थोड़ा सा एनालिसिस आपको करना है. और ये a student of whose age is 18 or 19 or 20, he develops that much power in his mind to understand what he is worth. You just have to tell him, or you have to ask him, and you have to give him some time. Socho.
Wait, there's more. But before we go further down the rabbit hole, subscribe to our channel.